Johnson.
I ask unanimous consent that the quorum call be dispensed with.
Without objection.
Mr. President, I came to the floor today to introduce a piece of legislation which I think is timely and I think very well needed. One of the reasons I decided to run for the United States Senate was the passage of the health care law. The reason I thought it was pretty important, because I said at the time that the passage of the health care law represented the greatest assault on our freedoms in my lifetime. I believe that's true, and I believe that's being borne out today. We are witnessing it today. The passage of the health care law resonated with me, made such an impact on myself, because my wife and I are beneficiaries of the freedom that we had with our current health care system. Our first child, our daughter Carrie, was born with a very serious congenital heart defect. Her aorta and pulmonary artery were reversed. So the first day of life, our daughter Carrie was rushed down to Milwaukee Children's Hospital, where a wonderful man, Dr. John Thomas, came in at 1:30 in the morning, did a procedure, and saved her life. 8 months later, when her heart was the size of a small plum, another incredibly dedicated team of medical professionals, in 7 hours of open heart surgery, totally rebaffled the upper chamber of her heart. Her heart operates backwards today. But she's 30 years old. She's actually a nurse practitioner practicing at that same hospital in which her life was saved. She just got married about 3 weeks ago. Now, our story has a happy ending because my wife Jane and I had that freedom. I was able to call up Boston Children's and Chicago Children's Hospital, talk to the preeminent surgeons in the world, which means in America, and find out what is the most advanced medical treatment, the most advanced surgical technique at the time. And we were able to avail ourselves of that. And I've got a beautiful daughter who's 30 years old, and she's also taking care of those little babies in a neonatal intensive care unit. I decided to pass this or file this piece of legislation today because, as a United States Senator from the state of Wisconsin, we have been getting a number of phone calls into our office of Wisconsinites that are getting letters of cancellation of their insurance policies. In particular, one couple touched my heart, gave me a great deal of cause for concern. This couple, who does not want to be identified because they fear IRS retribution, which is a little bit different story, a little off topic, but I guess I think it's worth pointing out. This couple, they both have cancer. The wife has stage 4 lung cancer. The husband is recovering from prostate cancer. It's in remission. Now, this couple had availed themselves and are currently covered under the Wisconsin high-risk insurance pool. It's a high-risk pool that works. I know in my business, when we had an individual that was lasered off of our insurance policy, those individuals were able to avail themselves of this sharing of the risk pool in the high-risk pool. And it works, and it's affordable. This couple received their notice of cancellation from the high-risk pool, and they panicked. They were in a panic. Now, when you have stage 4 lung cancer, the last thing you need is stress. Obamacare caused them a great deal of stress. It's causing them a great deal of stress. They tried to get on healthcare.gov almost 40 times without success. They contacted our office. We've done everything we can to help them. They've been in touch with some of the insurance carriers that will be part of the exchange participating in Wisconsin. They've gotten quotes. Now, this is preliminary, this isn't final. But under the high-risk pool, their maximum out-of-pocket exposure, including the cost of their premiums, is about $20,000 per year. He's working, he's got a good job. They could barely afford that. Preliminary indications show that that exposure will double to $40,000. And the only reason they may remain whole is that they may qualify for a subsidy. Nobody can calculate it yet. They've gotten 3 different answers. It's kind of like It's kind of like you take a tax return to 100 different preparers and you get 100 different results of what your tax is owed. But based on those preliminary estimates, it's looking like their total exposure won't be $20,000. It'll be more like $40,000, and their subsidy might cover half of that. So their health care expense didn't decline, as President Obama promised, by $2,500 per year. It's going to virtually double. And if it doesn't double, it's because the American taxpayer will be picking up that other half. So one of President Obama's primary promises he made, that if you pass a health care law, the cost of a family plan will decline by $2,500 per year by the end of his first term, that promise has been broken. That was not true. And of course, the other very famous promise the president made repeatedly was, if you like your health care plan, you can keep your health care plan. And I'd like to just go through a number of times President Obama actually made that statement. Looked the American people in the eye, trying to sell his health care plan, and guaranteed them if they liked their health care plan, they're going to be able to keep it. On March 6, 2009, he said, this is an exact quote, "If somebody has insurance they like, they should be able to keep that insurance. If they have a doctor they like, they should be able to keep that doctor." Then on May 11, 2009, Americans must have the freedom to keep whatever doctor and health care plan they have. On June 2, 2009, if they like the coverage they have now, they can keep it. That was in a letter to Senate Democrat leaders. On June 11, 2009, President Obama said Americans must have the freedom to keep whatever doctor and health care plan they have. On June 15, 2009, this is probably the most famous one that I remember, President Obama, in an address to the American Medical Association, said, if you like your doctor, you'll be able to keep your doctor, period. If you like your health care plan, you'll be able to keep your health care plan, period. No one will take it away, no matter what. Now, Mr. President, I think I've made my point. I've got another 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 other quotes that I could continue to read, basically make the same point, the same promise, the same guarantee. As recently as the beginning of this month, on the White House website, it says, we've got some good news for you. If you currently have private health insurance, you should be able to keep it. And that's exactly what the health care law says. Now, unfortunately, today over 2 million Americans have received cancellation of their insurance policies, the policies they chose, that for just a little time, a little more time, they have the freedom to choose. They won't have that freedom come January 1st. So either one of two possibilities are true. Either President Obama was being entirely dishonest to the American public when he made those repeated promises, those repeated guarantees, or he was totally disengaged from the process, did not have a clue what was in his own health care plan, or did not understand the incredibly negative consequences of that health care plan. Which brings me to my bill. The reason that President Obama claims if you like your health care plan, you can keep it, is that within the health care bill, there actually is a grandfather clause. And the first two paragraphs of that grandfather clause actually would work. The problem is those first two paragraphs or sections are followed by an evisceration of the grandfather clause. So basically what you have is you have a phony grandfather clause contained within the Patient Protection and Affordable Care Act. Well, my piece of legislation, the If You Like Your Health Plan, You Can Keep It Act, actually is a real grandfather clause, and it uses President Obama's exact language. So all my bill does is just simply strikes the phony grandfather clause, and it inserts basically the exact same language that was there, although we remove those exceptions, those mandates. In other words, we eviscerate the evisceration of the grandfather clause. So I'm here today to announce that I filed that bill. We have at least 35 Republican co-sponsors of the bill. I know the House is moving a similar piece of legislation. I know there's talk, hopefully, that we will be joined by our Democrat colleagues. It's just a really very simple proposition. I'm asking every senator to join me in passing this bill, the true grandfather clause, to help President Obama keep his promise to the American people. Now, I have to say, unfortunately, that Wisconsin couple that I would so like to help, so like to guarantee that they could keep their health care coverage, this bill won't help them. The only way we can help that couple is if we repeal the entire law because of guaranteed issue, high-risk pools are extinct. They don't exist. That coverage is gone. But if my Democrat Senate colleagues would join me in passing this bill, the If You Like Your Health Plan, You Can Keep It Act, we can keep President Obama's promise for millions of Americans. I think it's worth it. And I ask all of my Senate colleagues to join me in this effort. Thank you, Mr. President. I yield the floor. And note the absence of a quorum.
Clerk will call the roll.